Hello and assalamu alaikum, everybody. A very warm welcome to the second episode of It's a Match 2025 by MedAngle, where we bring you real stories and insights from this year's successful match applicants. Today, we're shining a spotlight on five very exciting specialties: pediatrics, psychiatry, emergency medicine, pathology, neurology, and general surgery. We've got a brilliant panel of speakers lined up to help guide the conversation. I'm joined by Ira Tariq, who's co-hosting the session with me. Over to you, Ira.
Hello, everyone. Assalamu alaikum. My name is Ira Tariq, and I'm a final year medical student just about to graduate from United Medical and Dental College, Karachi. And I'm thrilled to be co-hosting today's session alongside Aisha. Before we dive into the discussion, let's take a moment to hear from our speakers, each of whom has successfully matched this year. They'll be sharing where they're headed, which specialty they'll be joining, so we can get to know the faces behind the stories that we'll be exploring today. To start with, I'd like to invite Dr. Sara Murtaza. Dr. Murtaza, you have the mic.
Hi, everyone. This is Sara Murtaza, and I am a graduate of Rawalpindi Medical University. I graduated in 2024, and I matched in pediatrics at Rutgers Health Vermont Medical Center. Thank you.
Thank you, Dr. Sara. Next, we have Dr. Khan. Dr. Khan, you have the mic.
So I am an incoming PGY1 in pediatrics at SUNY Downstate University, New York, and I'm a graduate of Allama Iqbal Medical College, Lahore, Pakistan. So I'm very excited to join the webinar.
Thank you, Dr. Khan. Next up, we have Dr. Mohammad Ahmed with us. Dr. Ahmed.
Hello, everyone. Thank you for having me. My name is Mohammad Ahmed, and I'm a graduate of Dow Medical College, class of 2023. I applied only in psychiatry and matched into Charles Mary Medical Center, West Virginia.
Thank you, Dr. Ahmed. Next up, we have Dr. Ahmed Faraz.
Yes. Hello, everyone. Thank you so much for having me. I am graduate of Minuddin Medical College, Lahore, and I matched in pathology at University of Kentucky.
Thank you. Next up, we have Dr. Hashir Awan.
Hi, everyone. My name's Hashir. I am from Dow Medical College, batch of 23. I matched in emergency medicine at Vassar Brothers Medical Center in Poughkeepsie, New York. I'm very excited to be here.
Thank you. Next up, we have Dr. Hamza Jameel.
Hello, everyone. My name is Hamza Jameel. I'm a graduate of Army Medical College, and I matched in neurology at West Virginia University. Very excited to be here.
Thank you so much for having me. My name is Muhammad Zain Khalid. I'm a graduate of Liaquat National Medical College, and I matched into prelim general surgery at the Mayo Clinic in Rochester, Minnesota. I'm very excited to be here.
All right, awesome. Thank you so much for the lovely introductions, everybody. So the first section of this webinar is about the ERAS cycle and the ERAS timeline. It sets the stage for everything that comes after in the MAT journey. So without further ado, I'd like to hand it over to Dr. Murtaza.
Yeah. So about the ERAS timeline, so what actually ERAS is? ERAS is Electronic Residency Application Service, and if I had to put it in one word, how would I say it? It's basically a portal. You have to submit everything in it: your CV, your personal statement, your letter of recommendations, and even your transcripts, your MSP, and everything that is required from you is going to be submitted in that portal, so that the programs can be used. And mind it, they charge you a hefty sum for it. So so you have to, what you have to do is you have to successfully and very carefully curate it so that the programs know that you are the one for it, right? So when I am going to talk about the timeline of ERAS, it's about ideally a person should be done by their STEP exams in May. Every person has a different timeline. As Dr. Faraz mentioned, that he took his STEP exam late in September, right before his application deadline. But ideally, if you want to apply in March 2026 season, you have to start your application by June. And before starting that application, you have to be done by both step 1 and step 2 exam. You should already be prepping to take your step 3 exam while you're going to be in the US for your clinical electives or your rotations, which is generally advised that, for fresh LORs, you should be doing those in June, July, and August of the same season, right? So after doing your clinical rotations, it is also advised that you should also be done with your personal statement, your application part, your ERAS CV, and everything by the end of July. and start of August, so that you can get it reviewed by your mentors or by peers who are already matched in this same season, right? So considering that, it's also really important to get your personal statement, have multiple drafts of your personal statement. I mean, it's something that cannot be done in a single day or, in a week or in a few weeks. It's going to be curated over time. You have to do multiple drafts of your application. You have to keep writing your personal statement until it gets done to the point of perfection, or even after getting reviewed. I know there's a funny story that when I got my first draft of personal statement done, I showed it to my mentor, who was actually successfully matched in pediatrics at Cleveland Clinic. And what he told me was, he was like, I thought that my personal statement is very good. And it's, I got it reviewed by my best friend. I got it reviewed by my parents. And they were like, oh, this is the best personal statement we've ever seen. And when I showed it to him, he was like, oh, I am going to be really honest with you. This is not going to work. If you're going to match, then this personal statement is not going to be it. So point being that it's really important for you to get your personal statement and your application reviewed by someone who is working in the same capacity, who has the same mental capacity, who is already matched or who is going to be matched, So coming back to the point that about what should ideally be the timeline of Faez. So you got your token in June, and then you're going to work on your personal statement. You're going to work on your application part. You should remember that the deadline submission is going to be somewhere around the end of September. You have to submit all your MSPs, your transcript, and everything that is required by you until the end of September. And after that, that's the interview season starts, and it's from November to January. And some people do even get interviews in might as well in February as well. February is also the month where your rank order list is open. You have to submit your rank order list within a week or some, and then after that you have you get to know that whether you get matched or not in March.
All right. That was very informative, Dr. Sarah. Thank you so much. So now moving on, let's now talk about something that's on every applicant's mind. Section 2 is all about research and publications, and I feel like it plays a big role in the application process for many specialties. So we'd love to hear how you all approached it and what kind of experiences you had. Without any ado, I'd like to give it over to Dr. Zain.
Thank you so much. So one of the things that since I applied into general surgery, in order to have a comparative CV, it is very much lauded that you do a postdoc that is in the US for surgery. There's no fixed formula how to match into general surgery or comparative specialties, but if you have a postdoc in the United States for that particular specialty, that just adds to your CV that you are motivated enough for that specialty and you have that perfectly crafted CV for that particular specialty. I didn't have that kind of experience because when I came back from rotation, I wasn't able to find something paid. The only position I got was starting in mid of 2025. So I applied for the match. But I did have some research experiences while over here in Pakistan, which I think made a difference in my CV. I was actually the student head of the research society in my medical college. I published like 7 to 8 papers while I was in med school. Then after I did my house job at Aga Khan, I started working as a research associate over there. I did publish a few papers. To my benefit, I think you need to stay active in the research game. You can't be seen like someone who is not motivated enough to publish something significant. For a comparative specialty, you need to hit the ground running every day. And this is, I think, what makes a difference, in my opinion. And if anyone who is seeing this webinar and is a medical graduate and wants to get that perfect kind of CV, start looking for a postdoc in the US, because I think you get into the system, you make much more connections, and you are able to get much more interviews. This is what I have seen in surgery happens, and particularly in also other specialties. But I've also seen that it makes a difference in medicine and all its allied subspecialties as well.
All right, perfect. Okay, so we'd now like one speaker from each specialty to cover this particular question on how research a must for your specialty, or can a strong application stand out without it? Dr. Bilal.
Yes, a strong application can definitely stand out without research. And for pediatrics, research is not a must. You can match with zero publications as well. But having publication and research is always a plus point. It adds value to your CV. I had two publications and rest of the projects were submitted category. So they definitely added value to my publication and we can talk well about interviews as well.
Right, awesome. Okay, Dr. Faraz.
Yes. So about pathology, I believe research is important, but more than research, home country residence is important. The pathology enjoy a different flavor that the slides stay the same, whether it's in Pakistan, in New York, in India. So anyone who has the home country residency experience in pathology, they score a lot number of interviews, more than 15, 20, believe me. And the second thing is, yes, if they do also have the research, pathologists also love research, and they have some conference presentation in their CV. They receive some additional interview from the programs who also very much focused on academia. Otherwise, the one basic thing that is for pathology is home country residency.
All right. Okay, Dr. Awan for emergency medicine.
For emergency medicine, I genuinely don't think research matters to a point where you have to devote all your energy to it. It's not a must in the sense that your application would be somehow incomplete without it. It does help. It does add a certain level of attestation to your CV because, well, if you can publish something in an international journal, which means you have the right documentation skills, you have the teamwork skills, it does come up sometimes in academic programs, but if you're thinking about emergency medicine as a core specialty, it does not matter too much. It came up more in other specialty interviews than in EM.
All right. Okay, Dr. Ahmed.
Well, as far as my specialty is concerned, psychiatry, research is not a must, but it makes your application complete. So I had multiple publications, but I have seen people, with zero publication match into psychiatry. It definitely makes you more competitive as compared to others who do not have a research. But having a research is not a must in psychiatry.
All right, fair enough. Dr. Jamil.
So I think there isn't a straight answer to this question. Do you need research in neurology or not? But one thing that I would like to advise all junior applicants is that most of the neurology programs are academic and they're very research heavy. So having a research gives you many talking points during the interview. It shows that you can do research side by side with your clinicals, and I think if you present posters at AN, it's a great conference to network with attending neurologists, the program directors. There was a separate program director session during this AN at San Diego. You can just go talk to the program directors one-on-one, and they can acknowledge you. You can talk about research. You can talk about how to secure interview. Like it's so research helps a lot. But I've seen people, personally, I know people who have matched in community neurology programs without research. So yeah, it's not a straight answer. So, but having research definitely helps. If you can do it, I would advise it that definitely do it.
Okay. Next up, ठीक है. Let's shift gears to something that always sparks a lot of questions, the US clinical experience. How to get your hands on it, what specialty to do it in, and how to make the most out of it. I'll first hand it over to Dr. Khalid to first talk about USCs.
Yeah, so basically, USC stands for United States Clinical Experience, and you divide into electives, observerships, and externships. So, if anyone who is still in medical school and wants to do or get a flavor of how the US clinical system works, it is better for them to go and do an elective. I have noticed that many medical schools in Pakistan are now becoming VSLO accredited something. So there's like a proper channelized system in which you can find electives through your medical school. And I've seen big programs like Mayo, Yale, Hopkins accept those applications from those medical schools. And I think if you're someone who is planning to go and do a residency in the US and you're still in medical school, you should opt for that VSLO program. Since I decided to pursue the USMLE after I did my house job, the only option I was left was cold emailing people for observerships or externship. And once you graduate from your medical school, it becomes significantly harder for you to get hands-on clinical exposure in the US. Because in the B1, B2 visa, I think there's a kind of a category that you cannot do hands-on clinical rotation as a graduate in the US. So it's against the law as well. So the only shot you have is an observership. So I did, since I was a general surgery aspirant, so if someone is a graduate and wants to do a rotation, they should just look up online. You can get emails of supervisors or program faculty online from the websites. Just craft a well-written email with who you are, where you're coming from, what are your aspirations, and why you want to come to the US, and that hospital particularly, and with that doctor, that what that experience would you do to you or would add to your CV or your future goals. You should craft a well-written email and send cold email to most of the faculties. So there's a saying that if you email 200 people, you're going to get response from two only. So I did that. I started cold emailing, but I was lucky in a sense that I was able to get 2 rotations out of my 15 emails, which I think was largely due to that I wrote personalized emails, because every faculty in the US does check their emails regularly. So you need to make sure that you send something that is very personalized. And so I did one of my rotations at the Mayo Clinic where I matched. So I was only able to do an observership. So another point is that like how you can stand out in your US clinical experience, right? So in a surgical or in a comparative specialty, I think you should consider your rotation as an audition rotation. That they're gonna see you as a person who they're probably gonna accept you as a future resident or a prospective resident. So you're auditioning at that program like a person who is maybe a good fit for that program or not. So you need to make sure that you bring your A game into the rotations. You need to come off as a person who is likable, who is knowledgeable, who has good who has good leadership skills, who is a great team player as well. And the ultimate goal from a USC or a clinical experience should be that you get good letter of recommendations and possibly an interview invite from that program if it's a residency program. So it happened for me, and I'm very hopeful if someone does that rightly, they can also land the same kind of LORs, the same kind of interview invites that I was able to pull out, because as an IMG, you are already at a disadvantage. You are a South Asian, you wouldn't get much interview invites because you are in the pool of applicants who are like 10,000 people applying to the same program. What makes you different is the letter of recommendation that you get from that hospital, and if people know you from there. So this is the advice I'm going to give regarding general surgery, and I'd love to hear what other specialty people who match into them have an opinion about this.
Yeah, so I did 3 rotations, and one of them was outpatient rotation, and 2 of them were inpatient rotation. So I was advised to do more rotations at hospitals, that where you can land your interview at. But I wasn't lucky enough to get rotations at those hospitals. So what I did was that I was able to, impress, kind of the preceptors so that they were able to, recommend me to the hospitals that they have their colleagues at. So a great advice would be that you have to be, try to excel while during your observerships, whether those are observerships or electives or, any other kind of rotation. You have to be, you have to make sure that by the end of that rotation, you're going to land at least one interview, even from that hospital or from the hospital that your preceptor knows someone at or someone other, right? Thank you.
All right. Next up, Dr. Faraz.
Hello. So, sorry, regarding rotations. So my rotations are again slightly different from the rest of the applicants. I just did only 1 month US clinical experience before my ERAS application. But I did not came back. I did 3 more US clinical rotations. 2 were in the medical examiner office. They are the kind of guys who do the autopsies because I have a background of the forensics. So, and the third was in a private lab, and that was a derm path facility. So again, we used to scan slides all the day, and my all rotations were observerships. One was in a residency program, 2 were in a fellowship residency program. Forensic pathology is a fellowship, and 1 was in a private clinic or a private lab. And I did receive the interview from the residency program where I rotated. Uh, it was great experience. They gave me the good letter of recommendation. I believe that's why I received a lot number of interviews. One advice I do have regarding the rotations that I give to my junior is please diversify your rotations. What I mean by that, I did 1 rotation in Ohio and I received 3 interviews from Ohio. And my rest of 12, 13 interviews from all different states. And there was only from one from Illinois, 1 from New York, 1 from Connecticut, 1 from Vermont, 1 from DC. So I could not score any second interview from any other state, which make me think somehow maybe I rotated in Ohio and Ohio programs preferred me more than the other states. This is a key message that I could give, and that's it from me.
All right, Dr. Awan.
Yeah, I agree with Dr. Faraz actually, because I did a mixed bag of rotations. When I was in medical school, I did not have the opportunity to go for emergency medicine electives because, well, no one in the US wants an international graduate to come into their emergency department and also be learning at the same time. So I chose infectious diseases. That was always my backup. I wanted to go to public health. So I was like, why? If not EM, I'll go through ID. So I did my rotation in ID at UIC, which is a big name. And then after that, I went for an observership in anesthesia and critical care. Now I knew that I wasn't getting a rotation in emergency medicine, so I chose the thing that was closest to it. So either surgery or anesthesia and critical care, because that has a lot of procedures, that has shift work, that has a lot of teamwork that is being done from time to time. So I chose anesthesia. I went for anesthesia rotation, which was an observership. And while at that hospital, I spoke to the ER. So I told them, hey, I'm already here. I'm already been vetted. I've already have an observer card. So I can come meet you and see. I just want, some exposure into ER. And I had 2 weeks. And in those 2 weeks, I did emergency medicine observership. Now, the reason why I would recommend that if you are interested in emergency medicine, you should do an ER rotation is for 2 reasons. One, because it definitely does help you match and it gives that program director that sense of security that you know how an USER works. But at the same time, it also allows you to understand whether you want to do EM or not, because it looks fancy. It looks great on Grey's Anatomy. It looks great on the Pulse and Lennox Hill. But when you are actually in the ER, you start to realize this is either make or break for me, right? So I would recommend that you actually go, sit, do the shift, stay there for 12 hours and see if you want to walk home after that. And if you are ready to do that, great. I remember that after my rotation, I used to come home and I used to annoy my roommate. I used to make her sit down and I used to tell her all the cases. This happened and this happened and this happened. And it made me feel alive. That is where I knew that I wanted to do emergency medicine. After which I did an outpatient rotation in New York. The reason behind doing that was because I did not know what my step score would be. I did not know how my profile would look like 1 year down the line. So I wanted to diversify my options. I wanted to have some outpatient experience so that if I have to apply into family medicine or some other public outpatient facing specialty, I have that LOR with me and I have that experience with me. So I did a mixed bag because I knew I wouldn't be able to come to the US again. And that was very important. That is where I realized that, hey, I need to get all the experiences in this one big stretch, and I can't come again, and I can't afford to come again. So I would advise that if you're someone like me and you want to get more experiences, it doesn't hurt. It gives you a good understanding. And when you're sitting in interviews, it also allows you to tell them that, hey, I won't just be a great ER physician, but I would be good on my clinical rotations as well when I'm in the ICU, when I'm outpatient, when I'm in Peds EM, or so on and so forth. So I would recommend diversify, focus, keep yourself focused, and take chances, take risks. Don't be scared to cold email. Don't be scared to be nice and just go in and ask. Most people in the US, if you notice US medical students, they are famous for taking risks and they are famous for just going in and asking a question. Just because you're from Pakistan does not mean that you don't get that privilege. You should go respectfully ask a question, introduce yourself. Just don't be too persistent that I just want this and I want this and I want this. But don't be scared to, go out of your comfort zone, one step out. Keep one foot inside the comfort zone, but take one step out. So I would advise, take some risk. If I hadn't taken that risk, I wouldn't have never have flown on that helicopter, which I think was the best day of my life. So I genuinely feel you need to take that risk.
Okay, wow. Awesome. All right, Dr. Ahmed.
Yeah, so I did total of 6 months of United Clinical experiences, in which 2 months were of observerships and 4 months of externships. So it was a very diverse, all in psychiatry, by the way. So one month was outpatient rotation in Ohio. One month was inpatient rotation in rural area of Missouri, which in which it was divided. The rotation was divided into 15 and 15 days. 15 days I rotated in inpatient psychiatry and 15 days in consultant labs in psychiatry. And then after that, I did 4 months of externship in DC. So that's all about it.
Right, Dr. Jamil.
So I did 3 rotations in neurology. All of them were inpatient because most of the neurology in US is going to be inpatient. So one of them was a residency program and got an interview from there. They really give me like really good LORs. They helped me a lot actually. Physicians in US are going to be like very helpful if you're just respectful, you're nice to them and just be professional, they're going to help you. Um, Second was also a residency program but I didn't get an interview from there. But the physician gave me an excellent LOR. Because all the programs they talked about the LORs, those 2 LORs. And third one was it was basically a ruler program of fellowship in intervention neurology, but there was no residency program there. There was talk of residency program opening like next year or maybe yeah, sometimes in the future, but it was not a residency program. And I also received an excellent LR from there. Um, One thing I would like to emphasize is for it's I think it's specific for neurology that um, I was um, I was told by my mentors that my experience was very diversified. Uh, I targeted like different subspecialties of neurology, epilepsy, stroke, intervention, inpatient. So that's a great talking point, and it can actually make you stand out during interviews. So if you can, so definitely do that and make sure that your CV, your resume is geared towards neurology because neurology people are very selective about who they choose to interview. And they don't want someone who applies to neurology just as a backup. So, yeah, that's my side.
Fair, fair. All right, Dr. Khalid.
Okay, so I did like 3 rotations. So it was like 12 weeks of rotation, and uh, I was able to get like 2 LORs from each rotation. It depends upon how your impression is. And I think if you are able to get a personalized LOR for a specialty like surgery, it definitely makes a difference because it is kind of a talking point in your interviews. And they actually respect that if they see an LOR from a famous surgeon in the US, and which speaks volumes about how your work ethic is, how you're friendly, how your professionalism is. And I think it can help you open boundaries that you could never have imagined. So it's just like my opinion that to bring your A game in the rotation game, whenever you actually go for a rotation, give your best. Don't be like someone who is just there for just receiving an LOR. Make an impact, make a strong impact in that hospital. If it's a residency program, I would like to like advise that make sure that they like you and you get an invite from there because getting an invite is hard for non-US IMDs. It's very hard for comparative specialties. So, and people who trust you, they actually give you an invite, who have seen you. And if they know you in the program, I think that helps to get you inside the program. and particularly the top 5 programs. If you have, or if you get an LOR from there, I think it makes a difference even for community hospital. If they see an LOR from a big university hospital, they're shaken away that you got such a great letter of recommendation from one of the best hospitals. It just reinforces that maybe you are someone who they can trust you with in the future as a resident.
All right. Thank you, Dr. Khalid. Let's move on to something every applicant needs to get just right, the CV and the personal statement. We'd like to hear how all our speakers approached building their personal statements and CVs and what they focused on and how they made sure that it reflected their journey. So I'd like to start with giving the mic to Dr. Khan first. Dr. Khan?
Yes. So for personal statement, I would like to go stepwise. When should you start writing a personal statement? I would say 3 to 4 months before the ERAS application. Like before September, you can start it in July or May to write your personal statement. And then how you are going to write your personal statement. One advice, don't take help from the ChatGPT or any AI source. Like they can give you a very generic personal statement and any person can identify that it is AI generated. And now they have specific tools as well that they can identify. So write your personal statement on your own by yourself, and then you can take help from the ChatGPT to identify any grammatical errors or any mistakes, punctuation mistakes. And you can also run it through Grammarly, which can also identify some of the grammatical error mistakes. Okay, so how to write a personal statement? This is also very subjective. For example, one of my friends, some of my friends have written personal statement according to a single theme. One of my friend was very good in football, so he used it as a theme and then narrated whole personal statement according to that statement. He related the differences and similarities between the football and the medicine profession, and then highlighted his strengths. But if you are not going to select any of the hobby as a theme, then I made a specific stepwise approach for myself and for my friends as well. Like for the first paragraph, I used my personal background and journey just a little bit. Like in 5 lines, I'm going to tell about myself, my inspiration, about my family. Then in the second paragraph, I am going to tell about my medical school, about my clinical experience in Pakistan, and one example that made me, from my clinical experience in Pakistan, that made me interested in pediatrics. Then in the third paragraph, I wrote about my US clinical experience and gave one example from my inpatient experience, how I found it interesting, especially for pediatrics. And then in the fourth paragraph, I wrote about the program. And this is an advice as well for like, try to write a personalized personal statement for every program. I know it's going to be very hard because sometimes you are applying to 100 and 150 programs and you are not able to write the personal statement for all the programs, but pick out your top choices. Like for me, I picked up my top 50 choices, and for those 50 choices, I wrote a very personalized personal statement, specifically in the fourth paragraph, highlighting about their strengths of the program and why I am interested in their program. And in the last paragraph, just conclude in 2 lines about why I am going to be a fit for their program. And that's how, and personal statement is really, really important. In interview, if you have written a good personal statement, they're definitely going to talk about it and will ask about your experiences. And one advice also, it should be personalized. For example, you cannot be like that, my friend is wrote a personal statement and a very exceptional personal statement on the theme of football, so I'm going to copy that. No, make your own personal statement, and obviously it's going to be exceptional for you and not your friend. So try to find your own things, your own hobbies, your own data for personal statement. And one more thing, you have to craft your personal statement again and again. Like I guess 10 to 15 times is a must. And take advice from your mentors. You can take advice from your friends and from your family as well. But highly recommended is take your advice from someone who has gone through the process, who knows how to write a personal statement. Um, yeah, so this was all about my personal statement and about the clinical experiences. So one tip I would love to share about the CV, especially the clinical experiences that you are going to write in your CV. While you are doing your observership, take notes each day. And at the end of the rotation, go through your notes and identify what you are going to share in your CV. For example, if you presented a PowerPoint presentation, or if you gave a physical presentation, if you discuss something, if you managed a patient, if you gave an opinion about the patient management, you can write about that in CV, and then you can talk about that in your interviews. So I did it for my 3 rotations in pediatrics. I wrote each day what I learned, and then at the end of my rotation, I wrote all the points, like 5 points, what I'm going to write in my CV. Because this time they actually shortened the number of words that we can use for one section in the ERA CV. I guess it's now, I don't know what's the number of points now, but they shortened it. So you have, like, there are 5 to 6 lines that you can just write. So you have to be very choosy, because obviously you are going to talk about those things in your interview. And then there are 10 sections in the clinical experience. So I choose 3 for the clinical experience, one for from my Pakistan clinical experience, which was my house job, then 2 volunteer experience, 1 research experience, and 1 hobby. About the research experience, you don't have to mention all the things. You can just mention some of the projects and say that you are interested in research. And this was a feedback that was given to me by the program director of a residency program, that for pediatrics especially, you have to make a very random personal statement. Uh, you have to make a very diverse CV. Like, you cannot choose all the clinical sections, or you cannot choose all the research work in your CV, or all the volunteer experience in your CV. Make it diverse. Let them know that you are good at all the things. So that's how these things are going to work. So this is all about CV and personal experience from my side.
All right, thank you. Next up, we have Dr. Ahmed.
Yeah, thank you, Dr. Khan. He summed up everything almost. So, as far as psychiatry is concerned, your personal statement have to be personal. So you should mention why did you choose psychiatry. This is a really important question in psychiatry. So why did you choose psychiatry? You woke up and chose to be a psychiatrist? No, that's not a reason. You have to be, it has to be a gradual journey. It has to be a gradual journey. For years you are thinking about a patient, you're thinking about your rotation in 4th year of medical school of psychiatry. So it has to be a gradual journey. Why did you choose this field, and why, you are applying for specifically for this field with, certain LORs. So yeah, first para mention, little bit of, background of yourself, or, start with anything like any code or something, any beautiful psychiatric code. So I was very much involved in philosophical books. So I, gave a reference of a philosophical books in the start, and then I start my introduction from the second para. And then, I also second Dr. Khan's, that personalization should be personal to many programs, at least for those, you are planning to signal them. So, in psychiatry, we have 10 signals. So at least, your personal treatment should be personalized to specific programs of those 10, and then send to it. I know a, personal applicant, a friend of mine who, did that and received many interviews, 20 plus interviews in psychiatry, to get a personalized personal statement.
All right, thank you, Dr. Ahmed. Next up, we have Dr. Faraz.
So we are talking about personal statement and my ERA's experience. My experience is again slightly diverse or deviant from the main pathway. I will don't talk a lot about the personal statement. It's already explained very good. Regarding my ERA's experience, I mentioned 5 extracurricular experience in my ERA's out of 10 experiences. And believe me, they were discussed in all the interviews. Even if I could mention the other academic activities, I wanted to present program my true picture. I've been always in the different kind of the leadership role, different kind of the management role. Even most of you guys might be aware of the Young Doctors Association and don't think it's a good organization. I'm their spokesperson for a change. And I mentioned being spokesperson of Young Doctors Association in my eras. I mentioned President Student Council in my eras. I mentioned my debating society experience in my eras. I mentioned all those experiences, and they were discussed in all of my interviews. So what I learned from my personal experience is that program know a generic CVs from an international medical graduate. So they know 4 US clinical experience. Everyone do 4 because they are attaching 4 letter of recommendation at least. Everyone has a house job. After that, everyone has a fixed volunteer experience that they volunteer at some clinical some clinic for the underserved patients. Even if they do, I believe it's become too generic to write in the CV. I know most of my fellows may have wrote this too and it worked for them, but I don't suggest that. And then most of the people write student welfare society kind of thing. Okay, we did the blood donation drive, or we did those kind of the drive. So I believe what I learned from my personal experience, we should need to come up with a more diverse experience, and we also need to be more true in our my era CV that we actually are. What we used to do in our med school, what we used to do during our medical officer job or in during other jobs. So this is what I can add into this, uh, that our my era's 10 personal experience should actually tell the program who you are, and they are actually discussed, and they also give you a great opportunity to talk about. And most of the I remember in my 3 4 interviews they told me, okay, so you were a parliamentary debater back in your med school and you do this after a while. What was the parliamentary debate? We never do that, because most of the people just know the declamations. Someone said me, okay, can you teach me a skill in 2 minutes? So I just tell them, I can teach you the art of public speaking, and they actually laugh. Okay, you can teach me an art of public speaking in like 2 minutes or 5 minutes. I told them, yes, I can, and I actually tried them. So I will actually suggest this, those, right, those experience that you actually did during your med school, no matter they are diverse, no matter they don't look like a normal template that is being followed. Uh, and I believe that's it.
All right. All right. Thank you,
I
Dr.
do.
Faraz. Yeah.
Yes, sorry, sorry for interrupting again. So
No.
I do have another suggestion to. My timeline was not ideal, and I don't recommend it to be followed. As I mentioned, I give my step 2 on 11th September, and I have my flight booked on 17th September to Denver, Colorado, because I was presenting at a conference there, and I came back to Cleveland on the night of 23, and 24 was the deadline. So I did all my personal statement and my ERA CV during attending that conference. So it is doable to, I don't want to scare people. I know it's important to follow the timeline. I don't want to refute all the other presenters here, but I still want to mention that it is doable. But it also give me an edge, because when I was at that conference, I actually got a PGY4 of a Cleveland clinic who was presenting there, and I asked him, okay, I am applying for this match and I wanted to discuss this experience, and they said, okay, you can write this. I met a program director in that conference, and I told her I have a question for you. And she said, what is this? And she was the program director of pathology. And I asked her, I don't have any regional preference. Should I mention or not? And she said, leaving blank is not a good, according to my point of view. You should write. And then I asked her what I should write. I don't even know anyone in the United States. I just know there are certain regions that prefer the international medical graduate. And she told me, just write it like that. I am preferring the region because there are more international medical graduate in your region, and I will feel more comfortable if I come there. And that actually worked for me. I received interviews from all the regions I preferred. Uh, uh, I received even interview from the Connecticut. I have no connection with them. I just prefer them because of another program, and I received an interview from that region. So this is it from me about my IRA CV and my personal statement. Thank you.
All right. Thank you, Dr. Faraz. That was really informative. Let's get into program selection and signaling. We'll ask our speakers how they decided where to apply and how they approached signaling to make their choices count. I'll give the mic to Dr. Hasher to speak first.
Thank you, Ira. So program selection is something which I believe is the least personal thing that is in your entire application. Everything else is very personal to you. Everything else is very, something that you are creative about. With program selection, you have to be very, very, very in touch with the trends of applications and trends of matching in the last few years. Now, if you look at the suggestions that our seniors gave us 10 years ago, that was applied broadly. That was applied to all the places. That was applied to 250 programs and applied to one specialty. But now the trends are changing. The trends that are now we are looking at is that IMGs traditionally are more successful in certain geographical regions, in certain types of hospitals, and in certain specialties. Now, this is important to note because this is your starting point. you need to be very, very realistic when it comes to your program selection and your program signaling. The first thing I would recommend is make an Excel sheet. You have an amazing, amazing thing called Google Sheets now. So all you have to do is not even download an application, have a Google account and open a Google Sheet. My Google Sheet title was Match 101. You can title it anything that you want to do, but you need to have that Google Sheet. In the Google Sheet, you need to have separate columns of things that are important to you. So it could, for me, I would give you my experience, and this could then be up to you as to it is which is affiliated with a big consortium of universities. So you can have those. Yeah. So I would say label all those hospitals into different categories, into university affiliated community, and then make sure that you're also writing other things next to them. Now, on this amazing database called Residency Explorer. So as long as you have an AAMC ID, which is something that your school can provide it to you, or you can make your own account, you can have a Residency Explorer database. Now, this database is a little confusing to begin with. If you first look at it, I would say spend like a day or two just exploring how things work and how things are looking like. If you don't understand it, ask a friend or ask a senior and see how that works. Now, it has certain metrics in it. It has one very important metric, which is how many IMGs were interviewed by that program. Now, this is important. How many IMGs applied, and out of those applications, how many were interviewed? Now, this is one very important metric. Now, I didn't just write the percentage. I also calculated the amount of IMGs that were interviewed. Now, it could be 50%. Applications were 6, so only 3 were interviewed. So better take out the total application, then physically or calculator wise, calculate the number of IMGs who were interviewed. This is going to give you a very good insight into how things work. Then there is another data available, which is number of IMGs in the program. That is also very, very important because it allows you to understand whether that program traditionally likes or dislikes taking IMGs. Now, this is a matter of fact, and I don't think we can deny this, that there are programs in the US which do not like to interview or do not like to match IMGs. They may interview them. They may also give them rotations, but they don't give them the match, or they don't give them the interview. This is where the term IMG friendly or IMG unfriendly comes in. Now, if that number is high enough, you can consider that program as IMG friendly. So it is also going to convert a very objective, a very numeric data. So the amount of programs that you should be applying to should be disproportionately aligned with the number of signals in that specialty. So if you have a great number of signals, it means that the programs you do not signal are less likely to extend you an interview. And if the number of signals are lower, this means that unsignaled programs may also give you interviews because even they realize that 5 is a small number or 6 is a small number. Now, this, I think, is a great specialty demarker, and you need to know which specialty you need to apply more or less. I would say definitely go. We have examples of people matching into Mayo in this very webinar, right? So you should not be completely steered away from applying to big programs. But also keep in mind that if a program has not taken an IMG in the last 10 years, they probably wouldn't in their 11 year. And even if they would probably take a US IMG. So please make sure that you are a little realistic when you're selecting your programs for signaling purposes. I would recommend the signals should be divided into 1, 2, and 3. So you can divide them into 3 areas. One, a little below your profile, one which completely matches your profile, and one which is a little above your profile. The one that is the last one above your profile should be the least amount of programs. It should, because that's a risk that you are taking, right? So you should not be too risky with your signals. So I would give you an example what I did in EM. I had 5 signals. I did 1 signal to a program which is completely out of my reach. So I said, okay, well, I'll do that. But the rest of the 4 were either matching at my profile or below my profile. This allowed me to, get at least those 4 safe. And even if that 1 went to waste, well, that's 1 out of 5. 20% is still a good amount of risk that you can take. So that's my recommendation, that you should take a risk, but you should minimize that risk. Just don't get too carried away with the idea of, matching into the best place in the world. You can, but be realistic. Don't do that to yourself all the time. Also, speak to residents before signaling. that particular program. If you have a senior, if you have a Pakistani, if you have someone you know in that program, email them, ask them, my profile is this. Do you think that I am well suited to this particular program? Not as directly, but maintain a conversation and try to get some information out. It will allow you to know whether that program prefers step three, whether that program prefers research, whether that program prefers more USC, so on and so forth. There's a program in Chicago that I really wanted to apply to, but after speaking to that chief resident, I got to know that they don't extend interviews to people who haven't rotated with them. So I did not want to waste $30 on them, right? And especially a signal, which is limited commodity. So that's going to be my advice. And that's how I would divide uh, the signals that I have. So in this new era of signaling, number of programs goes down, number of effort in selecting your program list goes a little higher.
Yeah, Dr. Hashirman really summed up everything. Whatever he had said, I have followed, in this cycle. I have made a Google sheet. I searched on Residency Expert as how many, non-US IMGs were interviewed in the specific program. I have also, divided signals on my, priority basis, one, 2 or 3 programs above my, credentials, 3, 5 or 6 within my credentials, and 3 or 4, below my credentials. And luckily, I, got all the 3, interviews from, the program that I signaled that were above my league. So, it depends on your luck as well. You should try your luck, don't get carried away as well. Not all 10 signals, do not waste all 10 signals or 5 signals, on programs that, they are known to take, very high credential candidates. So at least, try your luck. If you have 10 signals, signal 2 or 3 Ivy League programs, 5 or 6 programs within your range, and 2 or 3, below your range. So that's all about it.
All right. Thank you, Dr. Ahmed. Let's now talk about interviews, how that experience was for our speakers and how they tackled it throughout the process. I'll now extend the mic to Dr. Khan.
Yes. So these days, interviews are really, really important because as the step one scores are now obsolete, so we are really dependent on other things of the application, including personal statements, experience, and how you present yourself in the interviews. So when you should start preparing for an interview, I would say in September. Ideally, honestly, I should say before September, but because the season is so busy with the ERAS application and the other things, so okay, during after you submit your application, you should start working on your interview skills. And now the question is how you are going to prepare for your interviews. What I did, first you should know what an interview looks like, what a residency interview looks like. So search on YouTube, just watch a 15-minute video of a residency interview, and then you may have an idea how a residency interview looks like. After that, get a PDF or the number of questions that are going to be asked during the interviews. All the questions that are going to be asked, the common ones, generic ones, and the situational ones, conflict resolution types, and the stress management types. All the questions you must have the PDF of all the questions, and it's easily available online. And then I would suggest make a group, either of your friends or from the colleagues who are going through the same phase, a group of 5 to 10 people, and then you are going to practice daily. I did twice daily with my colleagues, this practicing of interviews. And with first we practiced 2 questions daily. What should we present in these questions? And then when we have covered all the questions, then we started taking mock of each other. But at the end of the each week, what we did, we had a mentor who was US attending. We took a mock interview with the mock attending, and the other participants were just observing. So they may have an idea how an interview is evaluated. So during the 7 days of the week, you are going to practice with your friends, and at the weekend, you are going to practice with an US attending. That is going to help to evaluate your interview skills. Now coming towards the interview questions. So there are different kind of questions. The common ones like tell me about yourself, your strength and weakness, why should we select you? Um, where do you see yourself in next 5 to 10 years? What is your favorite hobby? These kind of questions, the common ones. And for these common ones, as you see, all of these are very personalized. There is not a specific set mark that you have to say these things. talk about those things in which you feel confident, you can talk well about. For example, in my tell me about yourself, I am, let's say in the hobby section, I'm going to talk about cooking. I should know how to cook because they can ask, oh, what kind of food do you make? And it happens during the interview. They usually ask me these kind of questions. So for these questions, all the generic ones, there is not a specific criteria, but you can share what you want to let them know about yourself. I know after all this practice, that tell me about yourself criteria is still not understood by all of my colleagues. So what usually the common thing that they present is their introduction, their medical school, their US clinical experience, and their hobbies. But what I felt that there is no need to be a specific on a specific pattern. You can go and directly jump on the hobbies if you want to. For example, one of my friend had a hobby of pickleball, and she usually presented that in each of her interviews, and that went well with her as well. But for me, I usually presented in a pattern wise, like my name is Bilal Khan, a graduate of Allama Iqbal Medical College, batch 2022, did my US clinical experience from these states, learned from these, interested in pediatrics because of this, and my hobbies are this, on a specific pattern. Um, Next, strengths, weakness. Again, this should be very personalized. You can follow a pattern, but because they are taking interviews daily, and if they are hearing common things, they may know that they're just following a pattern and not telling what is suitable for them. So again, I would advise pick up your strengths. All of the residents, all of us usually tell us the same strength. We are a team player, adaptable person, resilient person, and it does not make a difference, in all the behavioral situational questions. They are not really going to check out the scenarios that you have encountered. They are just seeing your approach, how you are going to deal with those specific situations. For example, they see you, if you ever face a conflict with a colleague fellow during your clinical experience. They are really not delving into the story what happened, but they are just want to know your approach. How did you approach the situation, your colleague? They ask you the question, if your colleague is not doing well, how would you approach that situation? They are really not going into the story. Again, they are just want to know your approach. And you can learn about those when you are preparing for your interviews during residency. So the purpose of all this talk is, don't take interviews lightly. These days, interviews really matter and are going to land you in your favorite residency spot. That's it.
Thank you, Dr. Khan. Moving ahead, would now like to invite Dr. Khalid to say a few words on this.
Yeah, I would second what Dr. Khan said. I think he made a valid point on this whole topic. The best, I think, for me personally speaking, interviews are a make or break candidate for candidates. Like after step one, when pass fail, after the scandal of the invalidation went viral, they really, I think, filter out people through their interview skills. And if you are someone who has a good CV but they can't express themselves in an interview, I think it's an automatic filter, and you need to be very serious whenever you go for an interview. And whenever they ask you, tell me about yourself, it should be like a pitch line. It's like a starter line that actually makes you want them. That it's a line that can make or break you. If you leave a strong impression by that question, I think you can just navigate the whole interview through that. So you need to prepare very well. Again, you need to start early, and you need to get actual feedback from people who are in the US. The one thing that actually helped me was getting advices from people who are in the system. You can practice as much as you can want with your peers and colleagues who are still in the same boat, but you wouldn't get it right if you're doing it right or wrong. You need to have people who are in the residency program in the US or are program director or associate program directors to give you actual feedback. And you need to have that kind of room for improvement. You need to be someone who is always open to get that feedback and improve on your skills. So the second question is that, like, what types of questions do you expect in a general surgery interview? I have seen like big places like Yale, Hopkins, Mayo, they focus on behavioral questions a lot. Like you need to be someone who can come up with an answer in within seconds. Like they're gonna throw you everything, like throw at you everything. They're gonna check if you have the leadership skills. They're going to check if you are here to just become a surgeon or a physician, or do you want to actually leave a mark in the United States, or you want to become someone who is a healthcare leader moving forward. So every answer is an opportunity for you to actually land a dream residency, but also sell yourself better. So there was a point an associate program director told me when I was just rotating. He was like, you need to be humble in an interview, but you also need to brag about yourself in an interview. Because at the end of the day, you are selling yourself in an interview. You don't need to come off as a person who is just humble, who is just content with everything in life. But you also need to show that kind of attitude that you are the best person out there in an interview, that they need to choose you. You are the best person in the market, and you need to make them want you. This is the advice I'm going to give for general surgery, because I think the interview made a difference for me, and I'm sure that if someone performs in the interview, it can definitely make a difference for them as well.
All right. Thank you, Dr. Khalid. Now, moving towards the end, we would like all the speakers to take the mic and share one unique thing about their experience preparing for their application for March 2025. Firstly, I'd like to invite Dr. Sara Murtaza, who matched into pediatrics.
Yeah, thank you, Ara. So for pediatrics, I believe that you have to show in your CV that you're really dedicated to peds. For example, a lot of applicants, they apply to pediatrics as a backup specialty, and that is something that program directors already know and they have their mind on. So what they want is that someone who is already dedicated to pediatrics. So you need to show that in your CV through your volunteer work experiences, either US clinical experiences or a home country experience or whatever it can be. And I believe that what helped me match in pediatrics is the fact that my volunteer experiences, they were centered mainly around kids. And you can do that by working in nonprofit organizations that mostly help children, or you can join a number of NGOs, orphanages that help underprivileged children. And that is something that was the main talk of that the program directors were really interested and keen on talking on. That is what helped me conversate more about it. So yeah.
All right. Thank you, Dr. Murtaza. Next up, we have Dr. Bilal Khan, who's also matched into pediatrics.
Yes, so from my experience, actually, I did a rotation at Memorial Sloan Kettering Cancer Care Hospital in the New York, and this hospital is affiliated with SUNY Downstate University, where I got matched. So during the interview, I told the program director that I did a rotation at MSK, and I was very happy to know that SUNY Downstate residents rotate at MSK for their hem-onc rotation. So she didn't go through my application before that, and after that, she opened my application and she was like, "Oh, you have already done a rotation there, and you know about our residents." I was like, yes, and she became very happy. So sometimes you have to let them know if they haven't interviews. This is how interview works. So yeah, that's my experience.
Thank you, Dr. Khan. Next up, we'll have Dr. Mohammad Ahmed, who's matched in psychiatry.
Yeah, so basically everyone is unique. You just have to show them that you are unique. Everyone, your family members, your friends, everyone has their unique qualities. You just need to show them that you are unique and you are capable of doing, a residency for 4 years in their program, working with other residents. Yeah, that's it.
Thank you, Dr. Ahmed. Next, we'll have Dr. Hashir Awan, who's matched into emergency medicine.
My specialty specific advice would only be know what you're doing and know what you're signing up for. Don't sign up based on vibes, and don't sign up based on how cool a certain thing looks like. Be very realistic with what you want to do, and also know that this is a decision that you're making for the next remainder of your life, right? So you need to be very, very careful in deciding what you want to do, but at the same time, you have to be very realistic of whether I would be able to sustain myself in the next 3, 4, 5 years. I see people switching specialty based on advice, but I would definitely say let your intrinsic understanding of how things work take precedence over what other people are saying.
All right, perfect. Thank you, Dr. Awan. Next up, we'll have Dr. Hamza Jamil, who's matched in neurology.
So, my advice would be that don't be all over the place. Some people advise that you should apply to like 3 or 4 specialties. I would not recommend that. Just stay focused, in your lane, apply to one specialty and focus on that. Have your resume geared towards that specialty. It's less time consuming, it's less taxing on your finances, and I think it gets you matched rather than just going all over the place and applying to like two or three different specialties because people in US can see through that. Anyone can see through that. So be true to yourself. That's what I would advise.
That was really insightful. Thank you, Dr. Jamil. Next up, we'll have Dr. Zain Khalid, who's master's into general surgery.
Thank you so much. So I would second what Dr. Jamil and Dr. Awan said. Like you shouldn't be signing up for a specialty because it looks cool or it just gives good vibes. You need to have that passion for that particular specialty because they see it right through. Uh, Particularly for like difficult specialties like emergency medicine or surgery, you need to have that kind of grit that you'd be able to go in the OR at 4 a.m. in the morning. Are you that kind of a person? Everyone knows that what kind of work ethic they have or they can bring to the table. So just be realistic. If you don't have enough exposure of that specialty, try working in that specialty in your home country. Don't be someone who's like, oh, it is just becoming easy and just go with the flow or follow the herd kind of a person. If you like certain specialty, put your heart and soul into your application. I i trust me, it works out. If you only believe in yourself and you put your heart and soul into the application, people actually start believing in you as well. So that's just my advice. If you like something, just go with it. Go and put your best effort into it, and inshallah, everything would go fine.
All right. Thank you, Dr. Khalid. Next, we'll have Dr. Ahmed Faraz, who's matched in pathology.
Thank you so much. So my advice is also kind of similar. Your application need to be focused around the specialty you are applying. Uh, I remember I did not mention 3 of my research articles that I published when I started my USMLE journey with my friends because they were all applying into IM and I just became member of their team. Even though I worked with them, I made very good illustration for those articles with them. But my mentor suggested me they are kind of diversifying your CV. You are a forensic guy, a forensic pathology guy who is applying for a forensics uh, a pathology match, so it should stay focused. Plus, I also observed this during my interview too. Kentucky was my first interview, and believe me, I was not kind of prepared for that. It came right after I just applied, and I was just managing all other situations, and I was so honest with them, so genuine with them, telling them what I used to do in Pakistan. And then I met my mentors, and they said, "Oh, you should not be mentioning forensics so much in your interview. Oh, you should you should also tell them I also like pathology. I may go into the anatomical pathology, may go into the dermatopathology." So I start mentioning them too, but my facial expression, my excitement change every time I mentioned that. And it showed up on the match day. I matched at the Kentucky where uh, I was myself. So this is also my advice. Stay focused on your application and also stay focused during your interview and tell them what actually interests you. They can see that they are expert and they are in the field for a long time. They are not taking interviews like the interviews happen in Pakistan, so they can see things.
All right. Thank you, Dr. Faraz. That was very insightful. On that note, I believe we are set to conclude this session today. On behalf of the entire MedAngle team, I firstly thank all of our speakers who took out time and were here with us today. To all those who are watching us, stay connected through our YouTube and socials for more such content. Thank you for watching. It's a Match 2025 was brought to you by MedAngle. Until next time, it's a goodbye from us.